There's been a lot said about why we can't afford to provide access to health insurance under Medicaid to Iowans, and I'd like to talk about the couple of reasons that we continue to hear. And the first one is the federal government can't afford it. As Senator Bolkcom noted, this has already been paid for. Money has been set aside to support providing health care to people across the country, including here in Iowa. I think we can afford to reduce the deficit and provide access to needed health insurance for working families. And frankly, I think it's irresponsible for politicians to use scare tactics and focus on something that will not happen. When did you all stop believing in America? When did you give up on the ability of the greatest country in the history of the world to solve a simple problem? Providing access to health insurance to working, tax-paying Iowans. When did you stop believing? Expanding Medicaid is voluntary. It is foolish and unfair to deny working families access to affordable health care when there is no real risk to Iowa and so much to gain. A healthier population is more productive, makes families more secure, and leads to a stronger, more vital economy. All the things we need to grow our way out of this debt. It's by getting people back to work. The free market does a number of things really well. Unfortunately, the free market has failed when it comes to keeping up with ensuring and making our population healthy. And there is no way Iowa can address the 250,000 uninsured adults in this state without the federal government as a partner. So as long as we have an employer-based health care system, we're going to have people that do not get health care that work in this economy. And people have talked about this already. These are working people that need coverage. Medicaid expansion is obviously the most efficient, cost-effective way to cover uninsured adults. The other reason we've heard is that Medicaid doesn't work, somehow doesn't work. Okay, so let's have a little lesson on Medicaid. Medicaid is not broken. The current program has actually been very successful. Iowa seniors have been able to stay in their homes longer and live with dignity in our fine nursing homes. People with disabilities and their families all have Medicaid to thank for improved health, security, and a chance to live in dignity. 70% of the current Medicaid spending goes to seniors and people with disabilities. 70% of the current spending goes to take care of seniors at home or nursing homes and people with disabilities. Complaining that people are not getting healthier is just bizarre. Medicaid is a health insurance program. It does not provide services. Doctors provide services, nursing homes provide services, in-home care providers provide services, people with long-term care needs that have disabilities provide services. That's who provides services. And if people want to complain about health outcomes, you ought to put your attention there, not on the Medicaid program. The Medicaid program is an insurance program. So people that complain about Medicaid, they don't know what they're talking about. They're making stuff up, they're scaring people, and they are wrong. The notion that we can improve the health care status of Iowans by continuing to have thousands of Iowans uninsured defies logic. The facts are clear. Every single person that lives in the state, including every single person in this room, at some point or another is going to need access to health care services. I don't care if you've taken personal responsibility, that if you've gotten up off the couch and you're working out, or if you've done prevention. You simply are not going to be able to get through life without health insurance. Just not possible unless you're a millionaire and you can just pay right out of your pocket. Most of us need the support of an insurance policy, and we sure as hell can't be the healthiest state in the country until everyone has access to basic prevention services and basic health care services. People get sick, no matter how much personal responsibility they take for their actions. It's time to move on. It's time to leave the tired past political arguments behind. We've had a court decision. We've had an election. It's time to move on and do the best possible job to implement the Affordable Care Act. That is exactly what is happening in a whole bunch of states led by Republican governors. Here's what the chief executive Republicans are saying and why they are moving forward with expansion across the country. Rick Scott, Governor of Florida, quote, I'm confident that the legislature will do the right thing and find a way to protect taxpayers and the uninsured in our state while the new health care law provides 100% federal funding, Scott said. Scott quoted some more. While the federal government is committed to paying 100% of the cost, I cannot in good conscience deny Floridians the needed access to health care. Jan Brewer in Arizona. Brewer said that if she did not accept the Medicaid funds for Arizona, other states could claim those federal funds and create jobs that otherwise would be created in Arizona. I think the Iowa Hospital Association says we're going to create more than 2,000 jobs with this. Brewer told state legislators that she did not want to forfeit the federal funds to other states that agreed to expansion, singling out such neighboring states as California and Colorado. Rick Snyder, Michigan. Snyder administration claimed the expansion will help Michigan's budget in the short term because it allows the state to shift some current spending onto the federal budget. The governor recognized these benefits will be temporary, and so he wants to put half of the projected savings of $575 million through 2020 into a lockbox. This is really a pretty interesting idea. Imagine the next 3 years under the governor's plan spending $162 million a year when we could spend zero, but taking the $162 a year for the next 3 years, setting it aside so that when we do have a 90-10 match, we've already saved the money to pay for it. I think this is a really good idea that Governor Snyder has. Brian Sandoval from Nevada. The law has been upheld by the Supreme Court. As such, I'm forced to accept it as today's reality, and I have decided to expand Nevada's Medicaid coverage. Susana Martinez from New Mexico. Over the past few months, I've done a lot of listening. I've met the health advocates, hospital leaders, both rural and urban providers, members of the business community, legislators, and many others. Quote, we have an obligation to provide an adequate level of basic health care services for those most in need in our state. However, we also have an obligation to ensure our state's financial security. In deciding to expand Medicaid, I weighed every possible outcome and impact. Ultimately, this decision comes down to what is best for New Mexicans. Jack Dalrymple from North Dakota, one of our, if money doesn't show up, it just doesn't get used, he said. That's far better to not have it there and have the money show up from the federal government in the middle of the biennium, and you'd wish you did have the authority to spend it. It's always better to err on the side of allowing it and then see what happens, according to his budget and his decision to keep flexibility for North Dakota. John Kasich, finally from Ohio, said, and I've got to tell you, I can't look at the disabled, I can't look at the poor, I can't look at the mentally ill, I can't look at the addicted and think we ought to ignore them, he told the audience. Kasich basically said that the expansion, he's on board with expansion because of his Christianity, he told fellow legislators, concerned about leaving the weak and vulnerable behind. Federal monies that come with the expansion isn't lost on Kasich. He also framed his decision as recapturing Ohio taxpayers' federal money. According to Kasich, funding for expansion is necessary to help Ohio's poor and mentally ill. Ladies and gentlemen of the Senate, this is the right thing to do. It's the moral thing to do. America thrives when we create shared prosperity, strengthen families, and treat all people with dignity and respect. This is unfinished business for our state. There's no way without a federal partner we're going to be able to manage this. We have a federal partner. Let's pass this bill and work together over the course of the next few weeks to make this law.